It will be a long fight, but if any country can see this through, it is Singapore.
Are you feeling very breathless now?
Yeah.
Okay, don't worry.
Our frontline staff are working extremely hard to keep Singapore going.
From day one, when we didn't really know much about the virus, we have actually put them out there in the front line.
The numbers may surge, but it is our responsibility to ensure that every patient is given the best standard of care. It's not time to give up. We must all continue to soldier on to contain the virus and flatten the curve.
As a paramedic, I have attended to numerous life and death situations before. And with the COVID-19 outbreak, there's a new deep appreciation for life.
Bring it forward first.
It has shown me the fragility of life and the important need to preserve it.
Now Hidayah will unload the tray. Yeah. Okay, you be at the back here. Okay, we have to move back.
We don't work alone. We work with a team of emergency medical technicians, EMTs. So we train together, eat together, and go for life and death situations together.
Okay, when you're ready.
1, 2, 3.
I ensure that I convey my patients to the hospital as safely as possible. There has been a little bit more added pressure, but I see it as another medical emergency.
Today we're going to revise rescue breathing techniques with the back valve mask, the BVM for short. Firstly, how many liters do we run?
15 liters.
Good. Okay, what clamp do we apply?
Yeah, the AC clamp.
Okay, how does the counting go?
Blow, 2,000, 3,000, 4,000, 5,000. Blow.
Blow, another blow. Can you demonstrate to me? How do you do the EC
three
clamp?
fingers at the jaw and then the C clamp on the BVM itself.
Okay. Remember to keep a good seal for around the patient's nose and mouth.
Okay.
Okay. So
Okay,
now
sure.
how do we administer the oxygen?
Blow, 2,000, 3,000, 4,000, 5,000. Blow. Everyone else is actually doing their part during this fight for COVID against COVID-19. Like, for example, nurses are doing their jobs, doctors are working extra hard. I feel that it's very meaningful for me to be part of this fight, and that we'll work together as a team to be able to prevent the further spread of COVID-19.
Great job.
They are 18 to 20-year-olds who just happen to be doing their national service at the time of this pandemic, but they've really stepped up to the plate and they are going out with their crews every day. But they still continue to do it on a daily basis, and it is tiring. They have to brave the elements, they have to wear the PPE, which is hot, but they're still doing it with a positive attitude. I'm very proud of my ambulance crew. From day one, when we didn't really know much about the virus, we have actually put them out there in the front line. The paramedics, as well as our full-time national servicemen who are working as emergency medical technicians in the ambulances.
I was one of those kids who were very proud of their dad's vocation. Be the first one to tell others that my dad's a firefighter. And it did indeed motivate me to join the SDF. Though our vocation might be different, the mission still remains the same, which is to save lives.
Okay, so all of this is in ERS course for this ERS.
ERS course.
All these guys, through the journey, just 1 and 2 people.
My dad always advises me, as a first responder himself, the importance of remaining operationally fit. This is because the member of public counts on us to deliver the best care.
Kuat duduk situ I know any parents will worry about their child safety and he's leading the crew. This is very concerned of me. Leading a crew with 1 national serviceman with him and 1 EMT. That's why I asked him to care of his crew. The worst thing can happen to him is when he will get this virus to him, accidentally or his negligent.
There's not much difference in attending to a COVID-19 patient compared to a regular patient. We treat every patient as how we normally would. There was a case where I had a patient who had a close contact with a confirmed COVID-19 case. Yes, help me stand by for case of SOB for male Chinese 64 years old, SOB low SpO2. Okay?
64 years old, case of low SpO2.
During the trip, he was very anxious. What I did was I comforted him. I told him that as of now, he was not in any immediate danger. He said, we're going to make a check on you, okay? Just relax. I'm going to check your pulse. Okay, I'm going to adjust the oxygen mask first. Okay. Is this okay for you? All right. Sir, how are you feeling now after giving the oxygen? Much better? Okay, that's great. Just relax. I shed some light on what you could expect later on at the hospital. We may not be able to treat or relieve the patient always, but we must always comfort them. Okay, Jasper, I need the heart rate and blood pressure.
BP is 135/95. Pulse rate is 98.
Okay, can I have the ECG strip? I hope and pray that patients will get the treatment they need and get well after sending them to the hospital. Okay. Jasper, thank you. Okay, so we're rushing off to the hospital right now, okay? After conveying the patient to the hospital, I feel fulfilled and accomplished. We've managed to send the patient safely to a facility where they can receive definitive treatment.
Among most of the frontline doctors who have been managing patients since the start of the epidemic, and with the leave suspension, most of us do feel a bit tired. Looking at Singapore's progress report thus far, I would say that it is worthwhile. Hello, hi, I'm Dr. Lin. How are you? We want to do right by our patients, right? So that is the first thing on every doctor's mind. For our patients to recover, to be given the best care possible. And what is really proven to work at this time is what we call supportive treatment, giving the patients medicines to relieve their symptoms, giving them supplementary oxygen, when they start to feel breathless, when their oxygen saturations drop.
Are you feeling very breathless now?
Yeah.
Okay, don't worry. I'll get my nurse to bring some oxygen for you. We'll give you some oxygen, then you'll feel a bit better.
But perhaps the most important thing that we do is actually looking out on a daily basis for patients who have early signs of potential deterioration. If there's any questions, you can just ask along the way. As a doctor, our foremost responsibility is to the patient in front of us. The numbers may surge, but it is our responsibility to ensure that every patient that goes through our hands is given the best standard of care. I think what's reassuring is that even though infectious diseases, physicians may be the ones spearheading and taking the brunt of managing these patients, over the weeks and months that we've been handling this, we've seen a lot of support from both our colleagues who are not in this specialty, who have been stepping forward to lend us a hand in coping with this epidemic. The number of cases of COVID-19 may be increasing in Singapore, and we have seen our first deaths, but it's not time to give up. We all must have the courage to continue to soldier on, to contain the virus and flatten the curve.
It's done. It's done. Okay, next question then. Chance one. You better back up with your mother tongue,
Why?
Huh? Not a good grade. Okay, study more. Okay, kids, mommy going to work. Bye. Alright.
Bye.
Do your homework, okay? And don't forget to sanitize your hand.
Yeah.
Right, bye-bye.
Bye, have fun.
Bye, Ma. I am Senior Staff Sergeant Noshida and I'm a police officer. I've been deployed at one of the government quarantine facilities as part of the whole of government's effort to manage the COVID-19 situation. Then you can collect and go inside again. The windows are closed, make sure they are inside. Technically, no one is allowed to go out and the pool is out of bound. No smoking. Make sure if you see any smoke coming out, cigarette smoke, you report to me. Okay.
Hi, Shida.
Hi, Vibun.
Hi. So right now, there are total of 150 PUQs in our site. Okay, 2 actually transferred to the NCID.
Oh, okay. NCID.
Yeah. So in total, right now in-house is 148 inside. Okay. So far, no special incident happens or whatever.
Oh,
yeah.
Here to visit my mother.
My role at the government quarantine facilities is to ensure that people who are quarantined are safe and well. I help ensure that persons under quarantines have minimal contact with others so as to mitigate further spread of COVID-19. So for now, there's no one can visit.
I haven't seen my mother in a while though.
You can actually call her or video call.
Okay. Is it possible for me to leave food or bring anything?
Yes, we can leave food. We can hand over to her, but no alcohol or cigarettes, no contraband things to get in.
Okay. Thank you so much.
You're welcome. In 2003 SARS outbreak, I was deployed at the government quarantine facilities. I felt that the work is very meaningful. As such, this time round, I volunteered for it. The windows are locked. PUQ inside? Yes. Okay. Okay. Let's go next door. Drainage area. Son? Okay. It looks okay. Oh yeah, the window open. I will inform IC. I'm hoping that I can do my small part in keeping my family and my fellow citizens safe from the virus. My family is my motivation. I don't want these infections to spread, and I don't want my family members to get infected.
I got you. You're the heaviest bear. Yes. Now shall make sure you fall.
Before the deployment, I had a discussion with my family of a plan that in case I've been infected, then there will be a plans that is will kick in, such as my kids will be placed with my brothers to be taken care of. I would be lying if I were to say that I am not worried. Given that we are dealing with a new virus with a high infection rate. The important thing is to keep ourselves safe through practicing safe social distancing.
In terms of COVID patients that have been managing, well, approximately 20 to 30. I mean, we can't really keep track. I think the most memorable one would be one of the elderly COVID patients that I had looked after, right? So both she and her husband were tested positive. They were part of a cluster, a local cluster from one of the church groups. So she was actually doing quite well. Her disease wasn't very severe. Hi, how are you? But on the other hand, her husband, who was also in the same ward and who I was also looking after, took a turn for the worse. And we did bring him down to the ICU. So I remember on the day that her husband went down to the ICU, I had to break the very grave news to her. Unfortunately, we have had to bring him down to the intensive care unit to support him better. Okay, anything you need us, we'll be just outside. She just broke down at that point in time. So many weeks later, after her husband kind of recovered, came off the ICU, at that time she was still isolated because she hadn't cleared the virus at that time. And her husband was well enough to actually text her on the phone through WhatsApp. She actually came to thank me. She asked my fellow colleague to get me over to her room and thank me, even though it was not in person, through the glass door. It's really heartening, for me at least, knowing that what we do, even at the individual level, is having an impact.
all depend on you.
I know. Yeah. I mean, the kids not too worried. It means the two of you that need to watch out and extra cautious. My parents, well, to this day, they still question as to why I've chosen to do infectious diseases, but I think over time they have sort of come to terms with it. You two better be careful because so far from all our data, it's the older folks who get it very bad.
Oh.
Every time I come back from work, I must say that it's reassuring to know that despite knowing that I've gone to look after patients who are positive, they do not shun me. They treat me as if like I'm just another usual human being.
Well, you have to eat well before you start on your work. We bought you breakfast, but you always don't eat. You're always rushing off.
Oh, there's food in NCID, no worries.
Okay, there's food, but make sure you have the time to take a proper meal. Right, Dad?
Yeah.
Sometimes we are thinking, why should you be in this specialty? There are so many to to specialize in. See, so we would not be so worried at this stage. And you are our son here. Your sister is in America.
Yeah, but it's my passion, right? So, and I think in Singapore the doctors are very well protected. We are all in very good equipment. We are all trained to handle this lah. So I don't think we need to be too worried. We know how to handle ourselves. Weekends have been mainly spent in hospital instead of the family. Thankfully, the family has been quite understanding so far, despite all the inconveniences that they have been put through. And being on the front line, the biggest concern is that whether I would, inadvertently transmit the infection to this vulnerable group at home. And honestly, over the last 2 months, there have been a few scares. I mean, I've fallen sick. I've had flu-like symptoms before. Thankfully, we've tested negative for COVID all this time. I have quite a bit of faith in our protective measures. Right, since 2003, when SARS hit till now, we have geared up. We have made plans. We have trained a lot more healthcare staff. I'm quite confident that in terms of the overall numbers, we should be able to handle it, even if, let's say, this pandemic goes on for a protracted period of time. Are you feeling a bit better now with the oxygen?
Nice to meet you. I'm Joel. I'm your principal nurse for the day. I'll be taking care of you for the shift. I would say we're the hands of the whole body of care. We are the ones doing all your administrations of medications. At the same time, I think we can provide some emotional or social support. Keep them calm, keep them happy in a hospital stay. I know it's hard for everyone that's in a hospital. No one wants to be here. But I guess we're the first line of people that you'll be talking to. So this will be a nasal cannula. It'll just go through your nostril then there'll be some air flowing through. Just tell me if you're feeling any uncomfortable. Just look straight at the door. Okay, 1, 2, 3. Okay, just bear with it. I faced discrimination. Me not wanting to say I'm a nurse because I work in NCID. They try to avoid you since you're a nurse. They think you're dirty. But I can't blame them. Everyone wants to protect themselves. So I do implore you that we as nurses also want to feel supported by the public. What keeps me going is maybe the smiles on people's face when you actually see them get discharged from the hospital. You're not even a nurse, you are actually a good friend that actually helped someone. Everyone has a part to play, even the public themselves. We all can support one another. It takes two hands to clap, so I don't think it's just us nurses that's providing the care. We can save lives together, protect ourselves from COVID.
I've been in ICA for 4 years. I decided to join ICA because I wanted to try a uniform group. I needed a kind of structure in my life. I feel that ICA is able to give me that kind of structure and discipline that I need. I'm a primary screening officer. So we conduct passport checks and security checks for arriving travelers coming into Singapore. Part of my duties consists of conducting interviews with returning residents to ascertain if they had displayed any COVID-19 symptoms or if they come into contact with anyone who is a carrier of the virus.
How about the stay-home notice? What am I supposed to be doing?
Okay, basically you have to stay home for a 14-day period. So you're not supposed to be leaving your house and minimize contact with any individuals who are not residing with you, to prevent the transmission of the disease. There has definitely been a shift in our role since the outbreak of COVID-19. This is not a conventional security threat. It is an infectious disease that has caused significant deaths around the world. Being at the front line, we are the first point of contact when these travelers come into Singapore. We actually have to tell them what they can or cannot do. This is the stay home notice, so you have to remain home for 14 days. And after that, this is to guide you for enabling your location services. I need to paste this. Okay. You just paste this on your shirt, you paste this on your shirt. It's okay. You can go. There are actually many new guidelines now, and it's changing according to the progression of this whole outbreak. Some passengers may still not be understanding of the importance of this stay-home notice. We try our best to be patient and guide them along.
Han, got the deployment ready?
Yes.
Yeah? So be prepared,
Yeah, prepared.
You okay,
Yes,
How are you doing today?
Okay, very good.
Good, okay. Far. So what's things?
Good, sir.
Yeah, ready for the next flight?
Yes.
What time the flight coming down?
Soon, in an hour's time.
Okay. Fundamentally, we are protecting Singapore. In peacetime, we will deal with syndicated activities. We will interdict criminal activities at the checkpoint. prevent the entry of contrabands and illegal items. So in pandemic crisis like this, we will still be protecting Singapore, but of course the enemy is slightly different. And Ifa and Noor, you've been briefed like earlier, just now there's a new measures. All the travellers that are coming back, all the residents coming back, everybody that we have to serve their stay home notice at the designated hotel. Yeah? We are the first line of defence. We have to get it right. We have to intercept travellers who may have been exposed to the COVID-19 virus, and we will then stop them at the checkpoint.
Actually, as of now, you are not supposed to go out at all.
The stay-home notice is very crucial for Ministry of Health officers to make use of the information that is given. So we seek the understanding of the travellers to provide us with accurate information. For example, their residence, the places that they have visited for the last 14 days. Yes, we do understand the anxiety on the part of the traveller when they come home, and we try our best to explain why they need to stay and serve their stay-home notice. So most of the time we will explain in detail with the traveller, and we will really ask them what is the concern that they have. We will address these concerns, we will allay their fear. Hi Denise.
Hi, sir.
How are you doing today?
Everything is great.
Good?
Mm.
Good. You did well last night, yeah, to handle the relief flight and then that little girl that you help out. That's very good. Yeah. I'm very proud of our officers. They rise to the occasion. Many of them volunteered to carry out the clearance, especially the high-risk flights that were coming in, on those relief flights from Wuhan especially. None of them hesitated.
My team and I volunteered to clear the chartered flight from the epicenter of Hubei. I was actually quite worried because I understand that this is a high-risk flight. So when I spoke to my father about it, he told me that in a uniformed group, you are not supposed to be afraid of such things. You have to be brave. So that itself actually inspired me to go ahead with the task. I think that we all have a part to play towards any form of difficult times that our country may be facing. It's just like when a soldier goes onto the battlefield, there's no turning back. If you're fighting for your country, you have to fight it with your all.
There are some cases out there in the community going undetected. There are more people out there who are infected but who have not been identified. And they may be passing the virus unknowingly to others.
Now, the situation has escalated to a global pandemic. We must all play our part. I'm a family physician. We aspire to be like the village doctor in the good old days. We aim to serve and treat all kinds of ailments within the community.
Hi, Dr. Seng. We have a patient that traveled to Korea between the 1st of January to 30th of March.
Okay.
So we're just thinking with ARI symptoms, should we isolate the patient?
We definitely should isolate this patient. I'm glad that MOH has the foresight to have a PHBC scheme in place. This enables us to provide subsidized treatment, and we are also receiving protective equipment to protect us. We're on the front line, so we take some load off from hospitals by sieving out the high-risk patients. Going forward, as the situation escalates, we will probably need to do more. I can say that most of us, we stand ready to the calling. We can help to identify COVID-19 cases. If confirmed positive case, we also able to manage and identify the sicker cases, and we will refer the sick case to the hospital and reduce the number of patients that the hospitals are managing.
I noticed that your throat is very, very red. It's a bit swollen as well. I think you have a throat inflammation. You also have running nose. And when I listen to your lungs, I hear a little bit of a noise. Yeah. This may suggest that you have a pneumonia.
The number of cases of COVID-19 increasing, but despite that, whether it's COVID-19 or any other ailment that the patient is suffering, it is the oath that we doctors take that we owe the patient a duty of care when it comes to see us. I think the respect and appreciations from the public are strong motivations to keep us going. When people ask me why I want to be a doctor, I think the answers to this question changes at different stages of my life. But one thing remains constant, and I think it's the same for most doctors, and that is being able to help other people. And it's the satisfaction that we get from helping others that keep us going despite the busy lifestyle.
Every day I'm asked, when's the cure coming? And it is difficult. Our lab has been doing serological work for a long time. We were trying to develop an antibody test that looks for everything that you've been exposed to in your body. And part of that, we had a panel that looks for coronaviruses, such as SARS and MERS. So when the outbreak happened, once we knew it was a coronavirus, we obtained blood samples from patients. We looked at, did they have antibodies in their body? And they did. So that was how we can tell who's been infected. So the next step is the therapeutic side to develop the drugs and antibodies. But compared to SARS, this virus is very different in the way that how contagious it is and the way that it's spreading. This is unprecedented. So we want to know what can we do to stop the spread of this virus. Everyone's asking, so, when's the cure coming? It's frustrating because it's not how it works, and things take a really long time to develop. You can work for years and years and years to hope that maybe what you're working on could be a treatment. Because I want to do my best to help, but there's only so many hours in the day, and time has to pass. And this is time that I guess we don't have because the cases are rising all the time.
Since COVID-19 started, our lives has changed dramatically. We now have to keep evolving with the situation, and we keep studying the virus and see how it evolves. By sequencing the viruses, we are characterizing the entire genetic makeup of that virus. With this information, we would know how it has changed through time, and using this information, we can pass it on to the researchers, and they will be able to make a change to the clinical outcome.
For this one, we have 2 positives and a pulse and a neck pulse as well. And this one we have 1 positive and the pulse and neck pass.
CT value is okay as well?
They are good.
Okay, good.
This is your X-ray in the hospital. You can see the body streams
Because there's no effective treatment for this particular virus, it's actually very important to enroll patients in randomized controlled trials, because this is the only way to tell whether the treatment will be effective.
Deep breath in and out. Good. Again.
So far, several patients have been recruited into this most promising treatment. And soon after, we will have some idea whether the drug will work. If the drug works, hopefully it will become available worldwide. Now, I do not want to dampen our enthusiasm and also the urgency. We must be prepared that there may not be an effective treatment. But at the moment, there are enough information for us to say there are drugs that we can test in a rigorous manner in sick patients in the hospital, as well as in less sick patients in the community.
No, I mean is that we have collected serial liver function tests in all the patients so far.
If we look at the statistics, sometimes one can feel, where are we going? But I think we need to look at the bigger picture. We feel a bit overwhelmed, and I think that is a reasonable, natural human reaction. One just to take a step back. I think we are still in a relatively good position, and we should work to stay in that position.
It will be a long fight, but if any country can see this through, it is Singapore. We have the resources, we have the determination, we are united.
We have seen an increase in the number of calls. You have to have the courage to carry on, continue your duties, despite the many adversities that we face now on the ground.
This is going to be with us for the long haul. I think the silver lining behind all this is knowing that what we do is having an impact on the overall way that Singapore is handling this epidemic.
We are fighting for a greater purpose, not just for ourselves. Courage is a way of believing that it will all work out in the long run. I'm fully optimistic that we will win the war against COVID-19. It might take some time, but we should persevere and continue working together